I'm Steve Kashul. Tonight, the Bulls and the Memphis Grizzlies. So happy to be joined by Dr. Brian Forsythe from Midwest Orthopedics at Rush, one of the team doctors for the Chicago Bulls, Chicago White Sox, and the Chicago Fire. Dr. Forsythe, thanks for joining us.
Thanks for having me.
Appreciate it. So let's talk a little bit about what you do and your specialty, I know, shoulders and knees. And let's talk about the big injury right now in the NBA, the MCL injury, MCL sprain by Kevin Durant of the Golden State Warriors.
Absolutely. So as you know, March 1st, Kevin Durant sustained an MCL injury. An opposing player sort of landed against his knee, and he buckled his knee inwards, and he sprained his MCL. And that in and of itself is a somewhat manageable injury, but he also sustained a bone contusion or bone bruise to the knee. That's the more unpredictable aspect of this injury. So a grade 2 MCL sprain, we would expect to rehab somewhere between 2 and 4 weeks, probably closer to 4 weeks in an athlete of his caliber with side-to-side cutting and pivoting demand. So the bone bruise is sort of the wild card, and that can take up to 2 months to resolve. So that's why they're going to reassess him at 4 weeks after the injury to determine what his progression might look like.
Interesting, Doc. Michael Carter-Williams had the bone bruise, and he was out quite a while. Is that almost a more severe injury than the MCL sprain?
That's a good question. Think of this as a continuum. You can have a mild, moderate, or severe bone bruise, and most, again, resolve within 2 months. Severe bone bruises might be expected to take as long as 3 months. So there is a spectrum, and it's very hard to predict. So that's why we have to sort of follow these athletes serially, on weekly, monthly checkups to determine how they're progressing and when you can sort of advance them to the next level.
So what's the treatment then, Doc, for like an MCL sprain?
So with an MCL sprain, initially the first 3 days you've got an inflammatory phase. And what you do to get through that is you work on, obviously, ice, anti-inflammatories. You immobilize the knee for a short period of time with a hinged brace so they can still maintain range of motion, but you can sort of protect the ligament from bending inwards and stretching out. So that first 3 days is critical for pain and swelling. The first 2 weeks or so is the time within which the ligament is really healing quite a bit, so it's very important to wear the brace. Thereafter, hopefully the ligament's healed, it's starting to take. Then we focus more on end range of motion strengthening. You focus on glute muscle strengthening, hamstrings, quads, and then you start working on functional movements, so sort of side-to-side and front-to-backward motions to gain that neuromuscular control that they're so dependent on to perform at such a high level. And you sort of want to retrain the athlete and make sure they're not doing things biomechanically where their knees are bending inwards in a knock-knee position, which might overload the ligament. So that's sort of the overall strategy that we employ with athletes like Kevin.
Dr. Brian Forsythe joining us here on our Bulls pregame show, one of the doctors from Midwest Orthopedics at Rush, sports medicine specialist and orthopedic surgeons, and also works with the Bulls, the White Sox, and the Chicago Fire. So, Doc, talk a little bit about the difference between basketball, baseball, and soccer injuries, what you're seeing, whether it's with the professional athlete or also with the weekend warrior, even the youth.
Absolutely. So it used to be that these injuries were seasonal. So kids were playing, soccer in the spring or the fall, baseball in the spring and summer, basketball in the winter. But in this era of specialization, kids are playing year-round. So particularly with baseball, we see a lot of overuse injuries of the shoulder and elbow. So it's important that kids adhere to their pitch counts. They got to do their stretches. They got to do throwing programs before going out there and trying to throw 100 miles an hour to build arm strength and to prevent injuries. With basketball and soccer, we see a lot more lower extremity injuries. So we see knee ligament sprains, so the ACL, the MCL, lots of ankle sprains. Basketball players tend to get more jumper's knee, which is sort of the overuse injury that the baseball players are subject to with their arm, and basketball players, it's their knees. So a lot of preventative work in terms of maintaining core strength, lower extremity strengthening, and working on your jumping mechanics can go a long way to prevent those from becoming chronic problems.
And then with the baseball players, I know you also have the Tommy John surgery.
Right, so that's what we want to avoid. So Tommy John surgery is when you tear the ulnar collateral ligament, which comes across the inside of your elbow, and everyone hears about these injuries and the 9 to 12 month recovery that they entail. It's sort of the urban myth, if you will, that you can come back from a Tommy John and throw harder, and faster than you did prior to the injury. That's not the case at all. It's sort of the intervention of last resort. When you have a ulnar collateral ligament sprain or a Tommy John ligament sprain, you got to rest it, focus on range of motion and strength, You want to work on your pitching mechanics, get a good pitching coach, and you really want to be very strict about rehabbing in a sequential way, so that you're doing a throwing program, you're building residual arm strength, which then enables you to throw, from off a mound or to do a bullpen session. So it's all about sequencing and adhering to fundamental principles.
Wonderful stuff. We're out of time, Doc. We appreciate you joining us here on our Bulls pregame show.
Thanks so much for having me.
Dr. Brian Forsythe from Midwest Orthopedics at Rush, one of our team doctors with the Chicago Bulls, Chicago White Sox, and the Chicago Fire. Back with more after this on Bulls TV.